Hello, class. My name is Vanessa Bernal. Today, my mission is to tell you that the federal government should provide universal healthcare to all people in the United States. As stated by Kimberly Amadeo in the article Universal Healthcare in Different Countries, Pros and Cons of Each, Kimberly states that the universal healthcare is a system that provides quality medical services to all citizens. The federal government offers it to everyone regardless of their ability to pay. This would be if we did have universal healthcare. The sheer cost of providing healthcare makes universal healthcare a large expense for the government instead. However, the United States is the only one of 33 developed countries that does not have universal healthcare. Today, I will talk to you about, and these are my three main points, that the poverty level increasing in those communities that do not have access to affordable healthcare, that drug manufacturers and insurance companies are to blame for rising healthcare costs, and that the government can impose regulations and taxes to increase overall health and healthcare. My first point would be that the poverty levels increase due to unaffordable healthcare. Health and poverty are incredibly intertwined. Being able to attend school, work, and earn a good living or feeding your family is dependent on a baseline level of health. As explained by Patricia Zapp and Kevin Kovac, poverty is one obstacle that can affect our patients' health. It is an insidious, self-perpetuating problem that affects generations of families. Beginning in and continuing throughout an individual's life, poverty affects health via complex mechanisms. To understand poverty, we must define it. The Center for Disease Control, the CDC, defines poverty simply as a condition in which a person or group that lack human needs because they cannot afford them. In the United States, the federal poverty line is expressed as an annual pre-tax level index by size of household and age of household members. For example, this year, the federal poverty line is $12,880 for an individual younger than 65 years of age, and $26,500 for a family of four. The American Community Survey revealed that 13.7% of the US citizens fell below the poverty line. And in 2020, that the youth, racial, and ethnic minorities, those without high school diploma, and the unemployment had the highest rates of poverty and lack of education. Now that we have the poverty level increasing in those communities that do not have access to affordable healthcare, let's talk about who's to blame. Let's discuss how drug manufacturers and insurance companies are to blame for rising healthcare costs. In spite of government attempts to control healthcare costs, they continue to rise. As discussed by Washington Policy Center, a recent poll done by Political and Harvard School of Public Health found that 54% of adult Americans believe that healthcare costs are a serious problem in the United States. The research conducted was through telephone interviews, both landlines and mobile lines, with 1,000 adults, including Republicans, Democrats, and independents. The findings were very interesting but not surprising. The majority of those interviewed blamed drug manufacturers, 79%. And then next in line was insurance companies, 75%. The basic difference between healthcare compared to other economic activities is the third-party payer system. The overwhelming majority of healthcare in this country is paid by employers or the government, with money channeled through heavily regulated insurance companies. In healthcare, patients are largely barred from shopping and have become isolated from the true costs that they incur. Why is this so? We have a finger to blame to the two highest percentage categories, which are the drug manufacturers and Big Pharma, and the insurance companies. Americans view the drug companies, the insurance companies, and the providers as a cause of the ever increasing healthcare costs. Big Pharma is just straight money hungry. I will show you a slideshow or a presentation as to 6 reasons why Big Pharma is to blame. 1 second. Let's see. So let's play this. And here we go. 6 things Big Pharma doesn't want you to know. 1, developing drugs is not as expensive as they say. 2, you're paying twice for your medicines. 3, about 2/3 of new drugs are no better than what we already have. 4, patients are extended over and over to prolong monopolies. 5, pharma bullies low and middle income countries. 6, pharma pockets more than they reinvest. So those are the 6 reasons as to what Big Pharma does not want us to know and why they are one of 2 to blame for healthcare costs. Let's stop sharing. Okay. All right. So my 3rd main point is the American government can impose regulations and taxes to increase overall health and healthcare systems. So the cure. I'm proposing that the American government impose regulations and taxes to increase overall health and healthcare system. In the healthcare system. This policy will implement universal healthcare to all. Everyone in the United States will be able to obtain proper healthcare across the board. This proposal will ensure access to quality care for vulnerable populations, as well as regulate healthcare markets and proper acquisition of new knowledge. How it will remedy the specific ills cited. But the universal healthcare system, poverty would drop. Simple human needs would be met. Healthcare will be attainable to any person in the United States. The poverty line would decrease. Youth, racial, and ethnic minorities will be able to obtain a high school diploma and education, and access to proper nutrition, shelter, safe neighborhoods in which they could learn, live, work, and have clean air and water, utilities, and other elements that define an individual's standard of living. And that would be met. Now that we have a solution, let's talk about costs. If we want this policy to work, someone will have to pay. According to the New York Times, universal health care for all would cost roughly the federal government $3.46 trillion. Under the current law, we have, let me show you where the monies are being basically allocated. Share screen, here we are. Here you go. So under the current law, the government estimates that the US will spend about 1/6 of the GDP on healthcare this year, with those costs divided between the federal government, individuals, employers, and state governments. As you see here, Medicare, 800 billion, Medicaid, 623 billion, other healthcare spending, 576 billion, private health insurance, 1.28 trillion, and out of pocket, 397 billion. Okay, so, let's see. So that's basically showing you where the monies is being, excuse me. Yeah, so where the money was going and where it's coming from. So this policy will implement universal healthcare to all. Everyone in the United States will be able to obtain proper healthcare across the board. This proposal will ensure access to quality care for vulnerable populations. The cost analysis under the national single payer system, more people would be covered by insurance and coverage would be more comprehensive than a typical employer plan or current Medicare coverage. In conclusion, I want to thank you all for listening to my presentation today. And today we talked about poverty level increasing in those communities that do not have access to affordable health care. 2, drug manufacturers and insurance companies are to blame for rising healthcare costs. And 3, that the government can impose regulations and taxes to increase overall health and help this problem. I hope it's the information that I have shared has convinced you as to why the federal government should provide universal health care to all people in the United States. I'd like to end with a quote by Michelle Obama. The truth is, in order to get things like universal health care and revamped education system, then someone is going to have to give up a piece of their pie so that someone else can have more. Thank you so much.